Hi, my name is Tia. I'm going to be your nurse today. Can you give me your name and date of birth, please?
My name is Rachel Melvin, 4/21/1978.
All right, thank you. So before we begin, I would perform general principles of safety practices. I would make sure the bed is a good working level, have her in a high Fowler's, and I would explain what I'm doing. So today I'm going to place a NG tube that the doctor has ordered, and I'm going to go ahead and place a clean drape over you. And then I would also see which nair is more potent. Thank you. I would go ahead and open up my tubing and the rest of my supplies. And then I'm going to go ahead and put clean gloves on. Alright, next I'm going to measure the tubing so I can get proper placement. I would measure it from the tip of the nose to the earlobe and then down to the xiphoid process, which is about right here. I got 50, so then I would mark that with tape or marker, and then I would then go ahead and get an alcohol pad and some Sure Prep for placement across the nose. Clean your nose, all that good stuff. And then next, I would go ahead and lubricate the tip of my tubing, 2 to 4 inches. And then next, I would go ahead and start advancing this through her nostril, and I'd have her head tilted back. And once I hit the gag reflex, I would then have her move her head forward, and I'd give her frequent big sips of water and have her swallow, and then continue advancing the tubing. And for the purpose of this video, I'm not going to tape it to her face or any of that. And then once I have the tubing in place, I would then go ahead and remove this and test the placement in 2 methods. I would go ahead and call X-ray and have them waiting for when I go to do my second method of placement. And then I would go ahead and do the first by checking pH. And then I would do this, pull a little bit of juices out, remove it, and I would go ahead, put this back in there. And I would want to test the juices on a pH test strip. And I'm looking for a level of 5.5 or below. And if that is, the level, then I would, that means I'm in good placement. So then next I would have the X-ray come in and check placement on that. And then also, I would want to check from during each shift the tubing from the tip of her nose to the rest of the tubing for signs of movement, and record that each shift to make sure there's no signs of movement and that the tube is still in the place that was originally confirmed at. So next I would also, if sectioning was ordered, I would perform sectioning, and then I would perform oral care and put chapstick on her nairs and her lips, and I would clean up my area, and I would continue to check on her for every 4 hours and make sure placement is still in the correct area, and then I would report and record.